does not have good balance, they are more likely to trip, to miss a step or whatever, and fall and injure themselves. And one of the long-term side effects we see after chemotherapy is osteoporosis. So if somebody is already prone to weakened bones or lowered bone density and they have poor balance, and they trip and fall, they're also at more of a risk for breaking something. So the combination of strength training and balance is essential for those people who are at risk for osteoporosis. All right, these are balance discs, and people joke around and say they look like little whoopee cushions, but they're just partially filled up with air, just like an exercise ball, but you don't want them overfilled because then they'll be so rigid they really don't challenge you as far as balance. So what actually creates the unstable surface is the fact that it's not blown up to its full capacity. So when you get on it, you're going to feel a little bit wobbly. Now, right in the center, you've got this circle here, and that's where you want to place your foot for the best balance. If you're off to either side, you're going to find that it's going to be much more difficult. Okay. And I put these right next to each other, which is the proper stance for most people, unless they were extraordinarily tall, in which case they might space them out a little bit more. So the first thing I'm going to have you do, Laura, is just try and stand on there and see how that feels. Go ahead and place each foot on there and just kind of let you get used to that. Now, when you're standing on here, try not to be very rigid. Keep a slight bend in the knees and just a natural stance. Let's focus on everything else we've already been doing. The belly button's drawn in, the chest is out, the shoulders are back, and you're doing the Kegel just standing there. Right? A lot of people will not even be able to do this. So for those people who this is a challenge, I have them do it in between a door jamb so that they can hold on to either side while they're working on their balance, all right? And it comes easy to you and I, but for some people, if they're really frail or they're older, they just are not coordinated, this in itself is going to be quite a challenge. Incorporating a little bit of core, but mostly the balance aspect, what I'm going to have you do is work through different planes of motion. So just a real generic explanation here. Your body is divided into top and bottom, left side and right side, and then front and back. So as we work through these different planes of motion, you become stronger in each of those areas. And so, as I mentioned earlier, if you should trip, if you should fall, you're going to be stronger to catch your balance, and just your ankle complex, all the muscles and ligaments and tendons that are involved down there are going to be strengthened simply from standing on these discs. Step off for a second so I can give you a little more information. For somebody who's undergone chemotherapy and they have peripheral neuropathy, particularly in their feet, this exercise may not come strongly recommended because they don't have the sensation that you or I do. They're going to have a difficult time balancing on these discs. So if they don't have the perception that you and I have, it's better to just skip this altogether. And they can still do some of the other aspects of what I'm going to show you, but not on the disc. So now what I'm going to do, we're going to get you back on there, and I'm going to hand you just a little medicine ball. Now this ball only weighs 2 pounds, and there are many different weights out there from 1 pound to 12 pounds. But to begin with, you want to start with something very light, and I don't skip any number in between, because if you're at risk for upper extremity lymphedema, we want to start with the lightest amount of weight possible, see how your body tolerates it, and as long as there's no swelling afterwards, then we can continue to increase the amount of weight or increase the intensity. But we don't want to start with too much, because if all of a sudden your arm blows up and swells up, we don't know at what point it might not have been in excess. All right? So, go ahead and stand up there. You're going to hold your arms straight out. And you know what? If this is too heavy to begin with, you can do the same movements without any weight. So I want you to draw your belly button in, pick your focal point, look straight ahead, and it's as if your hips are anchored, Laura. I want you simply to move your arms from side to side as far as they can go, keeping them straight. So as soon as your arms start to bend, you're done. Now keep a slight bend in the knees, look straight ahead the entire time, belly button's in, you're doing your Kegel, and breathe. Now it looks pretty easy, but it's not. And people really have to find that focal point and stare at it the whole time. That's essential for balance. Good. And periodically remind yourself, do the check. Am I doing a Kegel? Am I pulling my spine into neutral? Is my head erect? Are my shoulders back? How's that feel?
It's definitely working a lot of
Okay,
different
well
muscles.
let your arms relax for a second. Give your shoulders a rest.
You know, top and bottom.
Yeah.
It's gonna work.
You know what, and the average person is going to feel the fatigue in their shoulders regardless.
Definitely feel it.
Now the nice thing, because you are using a little bit of resistance, that will also work on some muscle tone. So most people following surgery and having been sedentary for a while are not going to feel real great about their body, and they're going to want to improve their body composition, increase their lean muscle, and lose body fat. And this will help to build some lean muscle while we're doing it. All right, so we've worked side to side. The next one I'm going to have you do is a little squat while raising your arms up overhead. Now, a couple things that are happening here. First of all, if somebody has bad knees and they can't do a squat, then they really don't have to do much of one at all. They can just bend their knees and just do the arm motion. Now, the person who has limited range of motion, so let's take the person who's had a mastectomy and radiation, and their affected arm can only go up to here. We don't want to use a weighted ball at all, because we don't need any extra weight when they can't even go through the range of motion on their own. So for those people, they're going to do this without any weight at all and simply work on increasing the range of motion in flexion, which is what this movement is. But let's assume that your range of motion is really good and now we're just working on strength, then this exercise is for you with the ball. So just begin right here, holding the ball, hop up on the disc. Step on there. Okay, pick your focal point. Now begin with your arms in front of you and just gently bend your knees. Really important that they're going straight forward, and then as you come up, your arms are going to go up. So hang on, bring them back down. We're just on a different page here. So everything is down. There you go, and everything is up. Perfect. Now what people do is they tend to be over anxious, if you will, and they'll bring their arms all the way up and arch their back and throw themselves right off the discs. So it's a very controlled movement, Laura. As you're coming up, tighten this all up and raise your arms up, but don't arch your back. Now let your arms come down a little further this time. Let them go all the way down so we're getting a nice full range of motion, and then all the way up. So essentially we're aiming for roughly 180 degrees of motion in your arms. Now if I were looking straight on here, I would see that your thighs are parallel, your knees and feet stay forward. That is perfect form. What we don't want to see is people's knees bowing out or knocking in. How's that feeling?
That is, I'm definitely feeling it.
Okay. All right, well let's try another variation on this. Go ahead and finish this one up. Okay, good. Relax. Now I'm going to just turn, this time I'm going to turn you around again. We're going to do this a little bit differently. Let me show you it first. So we're going to stand up on here, and this one's a little more challenging for most people. So we're going diagonally, but you have to still keep your feet going forward. So I'm going to pick my focal point. I'm going to keep my knees and feet going forward, bring my arms across to the side, and then come up to the other side. And it's really tough because most people are going to want to let their knees follow the movement. All right, so let's see how you do. Now look straight ahead. Keep your eyes on the focal point. All right, now right here, do your Kegel. Draw that belly button in, arms up. All right, so let's see if you can switch directions. Now that you've got that down, okay? So now you're starting on this side. Look straight ahead though, knees going forward, and bring it up diagonally. Awesome. Do your little checklist, do your Kegel, belly button drawn in, chest out, shoulders back. Very good. Okay. Perfect. So we've gone through everything. Go ahead and relax. We have all of these products available on the website, and we use Spry products, which are top of the line. They're the most durable, and you won't have to replace them every couple months because you can go buy them at the local store. But the problem is you get what you pay for, and a lot of those things will pop or just wear out much quicker than they need to. So these products last for a really long time. I've had these for years, and I use them professionally. Just remember, start and progress slowly. You know, rewind the DVD if you need to and listen to the cues that I gave in terms of when to push forward and when to back up. Don't forget the medical clearance, and by all means, if it hurts, stop doing it. There's a big difference between muscle fatigue, which is when you go, wow, I can't do another one because my muscles are really tired, and pain, which is that kind of sharp shooting electric, like ouch. You should never be working to that end, okay? Always stop long before that happens. If you have any questions, consult your doctor, your physical therapist, or if you're working with a cancer exercise specialist, ask them. If they've got you on a home program, call them up and make sure you're doing it properly. And if you don't have someone to work with you, we have a whole listing of people under the cancer section on our website.
Great.
All right, thanks for your help.
Thank you.
Take care.